Hi, everyone, and welcome to this in-session webinar on cupping for lymphatics, featuring Paul Kohlmeyer from Cupping Canada. I'm Karen Minahan, editor of Massage Magazine. In this session, Paul will take us through an overview of using cupping in lymphatic drainage treatments. Using research, he will explain why it may be advantageous to use cupping in certain circumstances. Paul will also describe some general precautions and safety considerations when using cupping in lymph drainage. Paul will also discuss concepts of how cupping can be used as a soft tissue modality to promote lymph drainage and how not all cupping techniques are capable of lymph drainage. So please type any questions that you might have into the chat. And I want to remind you that all attendees will receive a link to a replay of this webinar. Welcome, Paul.
Thank you so much.
Yeah.
I'm glad to be here. Thank you to Massage Magazine for hosting this wonderful webinar. I really appreciate the opportunity to come and talk with you and your people. So let's get into this. As we were talking, this is all about cupping for lymphatics, where we use cupping to work with the lymphatic system. So a little bit about me before we get going. So those of you who don't know who I am, my name is Paul Kohlmeyer. I've been a massage therapist for a really long time, since 1996. I've also been an acupuncturist since 2008. What I think this allows me to do is speak to both the Eastern and Western philosophies behind cupping, which is quite interesting. I've been speaking and lecturing and teaching since about 2006 on a plethora of topics. And I do that. I was doing it through the Massage Therapy Association of Manitoba. And when I lived there, now find myself in South Florida here, and I'm the owner and head instructor for both Cupping Canada and Cupping USA. So that's kind of where I am, and that's where I'm coming from. So my assumption in this is that this talk is on the core concepts of using cupping in a lymphatic drainage context. This isn't going to teach you all you need to know, obviously, to start doing cupping for lymphatics. Most lymphatic drainage courses themselves are anywhere from 2 to 4 days long. This hour is not going to cut it. If you are interested or you like what you see, please do take a longer course. I'm also assuming that you're comfortable with the anatomy, physiology, and pathophysiology of the lymphatic system. Because again, this is an hour-long course. I can't get too deep into that sort of thing, but I am going to try and bring a little bit of it here, because I think it is important to understand and define really what we're doing. And so with all of this in mind, let's start getting into why would you use cupping to promote lymph drainage? And the reason really is that, and my slide didn't click over, there we go. And the reason really is that we have some edema present. And I always come back to the science and what the science says about using any kind of intervention. And we know that there are 2 studies out there that apply I'm going to say a cupping-like device, because it's a mechanical device. It's not hand cupping, or manual cupping, if you like. And both of these studies show positive results when using this particular device with lymphedema patients. Now, looking at the specifications of that, it is really quite simple to use some of those specifications and mimic them by doing manual. And by manual, I mean using the cups yourself rather than using a machine to do them. So I think there's a direct translation on doing MLD with cups. So what this both of the studies were done by the same group of researchers. And the first one was a pilot study, and the second one, they delved into it with larger numbers. So these aren't a huge amount of numbers in terms of the science, but this is really all we have. Now, the interesting part in the larger study, they looked at how long the edema had been around for the patients or for the subjects they were treating. And what they found, which was really interesting to me, was subjects with chronic edema or chronic lymphedema, where the lymphedema had been around long enough to have fibrotic change in the tissue. Those subjects actually reported better results with the cupping treatment than with manual lymph drainage. And that was a direct relation. So half of the group in both studies, half of the group got manual lymph drainage and half of the group got the lymph drainage done with this cupping device. They showed in both that it increased range of motion, which is pretty typical of any cupping treatment. And they showed in both that it decreased pain and perceptions of disability in the patients. Again, and that's fairly typical of any cupping treatment, no matter how you do it. And that's of interest to me because of how we do it. And I'm going to get into that in the next couple of slides, or in 2 slides, I think it is. I really want to talk about precautions and safety, and then what it is about cupping and how we can mimic this device or MLD treatments, because really that's what the device is doing, in a manual sense. So, precautions of safety. So when we get into precautions and safety, because we're dealing with a very specialized population in lymphedema, we're talking about, we have to look at the normal precautions and safety around manual therapy, plus the normal precautions and safety around manual lymph drainage, plus the normal precautions and safety around cupping. So it becomes a fairly complex task of sorting through your patient's health history and their current health in order to apply a treatment safely and for their benefit, right? So, of course, you're going to screen for red flags. That's what your patient history form does, or any intake that you do. And these are, of course, conditions that make any of the treatments actually dangerous for either the patient or the practitioner. And that should be old hat. That's what we do in manual therapy all the time. So I'm not going to go into it very much. But then we have to screen for contraindications. And around here, when you're dealing with edema, the big ones are going to be infections, recent surgeries, if that's the cause of the edema, if they have surgical lesions in the area, if there are active cancers, anticoagulant use, organ failure in their history or currently, do they have the possibility of having a deep vein thrombosis? Is there any uncontrolled hypertension or any fractures present? So these are really the big ones that we want to talk about, because any of these can be problematic for all 3: manual therapy, manual lymph drainage, and cupping. So the interesting thing here is the one that's missing in that list is swelling and edema, because normally swelling and edema are a contraindication to local cupping. However, when we're applying cupping for manual lymph drainage, because of the way you apply the cups, that ceases to become a contraindication. It still becomes a caution, because you have to be cautious around it, but it ceases to be a contraindication in that you are trained enough and you know enough that it becomes less dangerous. Okay. And that's really what we're going for, is trying to limit the adverse events that are possible while increasing how the efficacy of the treatment, how good is the treatment going to be for the person. All right. So I'm going to say in this next slide, cupping can be used to promote lymph drainage. And we do that by mimicking the strokes and patterns of a normal manual lymph drainage. Now, if you think about manual lymph drainage, and I hope a lot of you have taken manual lymph drainage courses before, because I think they're really important as a stepping stone to understand how you can use cupping with manual lymph drainage, is that there are a number of characteristics of a lymph drainage treatment that aren't the same in other forms of manual therapy. And I go so far as to have heard manual lymph drainage teachers say that manual lymph drainage is no longer really massage, which I think is a stretch, but I think it promotes the idea, which I think is important, that it is very different and you're working with different pathophysiology or physiology and anatomy in manual lymph drainage that you are in massage or manual therapy. So with that in mind, we are going to use cupping in ways that mimic the strokes and patterns of a manual lymph drainage treatment. So the characteristics that we want to attend to is that all suction is going to be light. Okay, so if you are applying any cupping in any areas to influence lymph drainage, by definition, the amount of suction you're going to use is on the lightest end of the continuum of light to heavy suction. So you have to remember that when we think about cupping, we think about suction being kind of like pressure when we're doing massage. And as such, in manual lymph drainage, the techniques are all done on the skin. It's all very, very light techniques. In fact, in a lot of cases, your patient is going to, or your client is going to say, what's going on? This is so light, I don't understand. Because every other time you've treated me, you give me this nice deep treatment or this moderate pressure. Whereas manual lymph drainage is extremely light. It is meant as a treatment done on the skin and maybe the tissue underneath it. So with that in mind, if we're going to use cupping, we have to use light suction. The number two thing that we really want to think about is that all of the techniques that we do in manual lymph drainage are specialized techniques that we really don't see very much in other styles of manual therapy. And as such, we have to think of the techniques that we use in cupping probably need to be adapted to those, to mimic, I guess, those specialized techniques. Because in manual lymph drainage, the techniques are almost always done with a very specific speed in mind, a very specific duration of how long you hold a contact with the skin and then release it. So we can, again, mimic that with cups in that we can apply a light suction. We can leave them on for very short periods of time. We can take the cup and stretch the skin a little bit and remove the cup, thereby releasing the suction and the stretch on the tissue. So when we are using that, we tend to think of, if you understand the techniques of cupping, we tend to use flash cupping or fast cupping as the baseline, or even massage or dynamic cupping, depends who taught you which of that language you'll use. But massage and dynamic cupping are generally seen as the same thing. And they're done in such a way to promote lymph drainage in that they'll mimic the hand positions and what you're doing with your hands while you're doing them. Because that's not super specific, I put together a video doing two parts of the body. I start off with a leg, the quad actually, and show lymph drainage, and then we do the face. I'm going to stop my share for a second and then reshare a video of what this can look like. Okay, so give me 1 second as I swap over and I share. Where'd my video go? That guy right there. Excellent. And I'm just going to start it from here. And I'm going to switch hands in a second just so you can see. So this follows the pattern of working with the manual lymph pathways of the quad. Usually we start somewhere around the inguinal area in the groin area. And we do some very light, this is flash cupping. In this, I'm using a silicone cup. You can just as easily use a vacuum cup. Also very easy to regulate the amount of suction you're using. And as you can see, there is not a lot of suction here that we're using. So now I'm following the lymphatic pathways up towards the what do they call it? Watershed points, or the collecting areas. So usually from the leg, we work up into the groin. It's the way the pathways flow. So I'm just following them from distal to proximal, lateral to medial. I'm using both hands because then I don't fatigue as a therapist, but also whichever one gives me the better mechanical advantage, in that I want to keep my posture comfortable. This is most of the time called fast cupping. This style leaves a cup on just a little bit longer, usually done after the tissue has been warmed up with a little bit of flash cupping, which was the first technique that I used. And it's basically leapfrogging the cups along the lymphatic drainage lines from distal to proximal. And you can always go back to fast cupping, which is what I'm doing here. This treatment is done very methodically, quite slowly compared to other styles of cupping. And now I'm moving on to the lower leg. I find this the most relaxing thing to watch. Hope you're not falling asleep on me. So again, following along the lymph pathways, starting with flash cupping, we'll get to fast cupping as well. Now, this can be combined with any other manual lymph drainage that you tend to do. If you do a lot of, in your manual lymph drainage, do a lot of joint pumping, you can add that in between. That's just fine. It's not necessarily a one or the other. It can be both. It can be a combined effort. And in fact, mostly when I apply it, I will combine them, using cupping over areas that tend to be a little bit more fibrotic. So you can see that there is some deviation. I am pressing into the tissue, but only just to meet it. I'm not pressing it in order to try and create a seal. I'm pulling the cup to it, letting the seal happen, and then letting go to apply suction, and then pulling the cup off. I've taken the audio out of this video just because there was a fan running in the other room that we couldn't shut off. And but otherwise you should be able to hear a slight pop every time that cup comes off. And that's indicative that you are doing flash cupping correctly. One of the things I like about doing cupping with lymphatic drainage is that I don't have the same slightly bent forward posture that I often get into when I'm doing manual lymph drainage for a long time. I find the combination of the two easier on my lower back as a person doing the treatment.
Hey, Paul, would this be a time when I could ask you a question that's come in from our audience?
Yeah, absolutely.
Okay, so Amy mentions that it doesn't appear that you are using any oil on the client's skin to do the cupping, and she wanted
Correct.
to ask about that. Is that correct? Okay.
Yeah, in this particular case with flash and fast cupping, oil actually makes the cup slippery, so it's harder to apply it. You have to use more energy of your own on your hand. So here, because I'm not sliding the cup at all on the patient, I'm putting it on and pulling it straight off. I'm not using oil specifically to make this easier on myself. Now, if I was doing a massage cupping technique, which I think I get into, it's either late in this one or early in the neck, we do add a little oil because we want to stretch, we want this cup to slide a little bit. It makes it a little bit more comfortable. So it's more for patient comfort than anything else, but this is such light suction. There usually isn't any problem with that anyway. When you talk about patients with edema, often they're restricted into what sorts of emollients you can put onto their skin anyway. So being able to apply cupping with no oil is a smart habit to get into, because in some cases, you're not going to want to put any anyway.
Thank you. And another question came in regarding edema. Alana asks if this cupping technique can be done on edema from a recent injury, sprain, or strain, and if there's bruising present.
Yes, but I would say the caveat to that is it's usually done proximal to that injury. Okay. You follow the indications and contraindications as you go, right? So if the injury is so bad that it's created bruising and localized edema, the first treatment or two, the treatment might be proximal to that, because we don't actually want to apply it right over the area. Mm-hmm. And further into it, as it gets out of an acute stage and the body has had time to deal with it, we can then start moving over top of that injury.
Okay. Another question came in. Do you want me to ask it now or wait?
Yeah, go ahead.
Okay. So Leanne asks about incorporating nodal pumping and flushing with the cups, how you do that, and if you would actually recommend taking an MLD course before learning cupping for lymphatics.
We've made it for our course, we've made it that you need to have taken a cupping course, but not a lymphatic drainage course. So we're introducing all of the concepts of manual lymph drainage that you need to know within the cupping for lymphatics course. Other instructors may need you to take a lymphatic drainage course first. Would it be a really good idea to take one? Yes. If you have some cupping, have some manual lymph drainage courses under your belt, it'd be a really good refresher to, I guess, reemphasize those thought processes in your mind. And it will allow you also to do cupping as well. So you'll be able to focus more on the techniques rather than on the theory, I guess. Now, in terms of combining them, absolutely, nodal pumping, you can do it with or without the cup. In fact, nodal pumping in the class, we do it with no suction. So we're using the cup as a tool to apply force. So you can do it just like that. You can do, what was the second part? Nodal pumping, and the other, what was the other one?
Yeah, let me just get back up to that. Just a second here, sorry. Nodal pumping and flushing with the cups.
Yeah, I don't do very much flushing with the cups because I don't know what the author of that question actually means by flushing. We don't do like long effleurage strokes. It tends to run counter to what manual lymph drainage tends to do. So we do short like J strokes. If you're talking about massage cupping, we'll do short J. Look, the strokes are literally, you put the cup on, create a shear in one direction, and then as you're removing the cup, you 90-degree shear it.
Okay. Thank you.
Yeah, no problem. So here is just demonstration cupping of the face and neck. So we started with the neck, and now we're working with the face. Most of the time we'll use flash cupping for this. It is one of the most comfortable techniques to receive. It's very comfortable, very good for wind down of the central nervous system. So that's what I think creates some of the change in pain perception, is that slow, steady, almost monotonous type of treatment. And we can change cup sizes depending on what we're doing and where we are on the body. So we started in the neck. Again, it's a very normal manual lymph drainage technique to start with the neck and then do the face after that. So we're just, again, following the hand positions and where you'd put the hands for manual lymph drainage. This, of course, is an abbreviated demonstration so that it would fit in within 15 or so minutes, because this treatment can be a fairly long treatment if you're very thorough about it. And each time you'd take the cup off, there would be a little popping sound, which is good for those of us who are orally inclined, so we can hear it. It helps keep our timing. Obviously, when we're doing manual therapy with cups or manual lymph drainage with cups, we are mostly going to apply this where we have access to skin. So if our patient was male, had a beard and mustache, I would probably do manual lymph drainage with my hands rather than cupping for lymphatics, just because it's a better contact.
Paul, we did have another question come in, and it's
Sure.
regarding when you were working the lower portion of the body. Noel asks why you started at the quad and went down the leg to the foot and didn't cup in the opposite direction toward the heart.
Right. So one of the principles of manual lymph drainage is you always start at the center and work your way outward. So most of the time, we actually start at the neck because the lymphatic system drains into the superior vena cava on both sides. So we tend to, and I'm just going to go back to my PowerPoint here. So we tend to start with the neck, and then as we are working down the body, if I was going to treat the leg, if that was a full demonstration or full treatment, I would do the neck, chest, abdomen, and then the leg. And I start from the top and I work my way down. And the idea here is that you clear the pathway for lymph to go before you start trying to push fluid in that general direction. Because if a person has a lymphedema or a systemic edema, you've got to make a pathway so that lymph has somewhere to go. And so you drain, if you think of, I don't know if you're in the winter, if you're in a winter place, but in the spring when stuff starts to melt, when the roads start getting full of water, and you'll see people go out and you take out your ice pick and you go pick around where the sewer inlets are. Because once you've done that and clean that area out, all the drainage, all the water has somewhere to go. It's kind of that same idea. You have to clear at the superior vena cava, where the lymphatic duct and the thoracic duct come in order for the lymph to have some place to go.
Thank you.
Yeah, no problem. Any other questions before I move on here?
Well, Jill is asking where she can find a conical cup like the one that you're showing in the video.
Oh, these are usually called silicone facial cups. They're readily available online. We sell them, if I can make a little plug for Cupping Canada or Cupping USA, depending on where you are. You can get them on our website. Other people sell them as well, though, so please take a look around.
And we just had one more question come in. How does the practitioner practice self-care to prevent repetitive use issues in the wrist?
Yeah, and you do that by doing both hands, changing it, doing some work with manual lymph drainage, so you're not repetitively doing the same things all the time. You can use vacuum cups versus silicone cups, and that will change what you're doing. Now, repetitive strain injury is really interesting to me. There's a few pieces of research out that say that if you have repetitive strain injury or you want to prevent it, you have to do about 5 minutes per hour of something different from what is probably going to create a repetitive strain injury. So within the context of manual therapy, doing 5 minutes of manual lymphatic drainage at the same time would be a good idea. Doing 5 minutes of joint pumping or other styles of treatment where you aren't always doing exactly the same thing. Switch it up between the silicone cups and the vacuum cups with a pump. And I would suggest if you're going to use the vacuum cups with a pump, doing flash cupping, you'd use a hose, and doing fast cupping, you wouldn't, just because of how easy it is to do those techniques with or without the hose. So, and changing what you're doing rather than doing exactly the same thing all the time. And that's just, once you get comfortable with one kind of cup, just move to a different kind of cup, get comfortable using that, get comfortable adding in joint pumping, things like that, so that you can do different things throughout the hour-long application of lymph drainage or cupping for lymphatics. And that should ease off any repetitive strain. The lovely part about cupping for lymphatics is I find use the softest cups you can find, which you wouldn't necessarily use in a sports setting or another manual therapy setting. You tend to want a heavier, stronger cup because they tend to give you a little bit more suction. But with lymphatic drainage styles or cupping for lymphatics, you want to use the lightest suction you've got. So you're not fighting with the cup a whole lot. You're not squeezing it really hard. It's just a fairly easy squeeze, or it's one pump on the air pump. Or if you have an automatic one with just a hose on a machine, it's just movement of your finger closing and opening the hole. So fairly easy.
Great.
Does that work? Okay,
That's all the questions we have at the moment. Thank
excellent
you.
news.
Yeah.
So let me move on a little bit in mine. Um, So one of the things that I like to think about is how cupping is perceived in the industry. And one of the things that people talk often about is cupping's ability to move lymph. And I would suggest to you that it's not true all of the time. I think there is an interesting intersection where cupping is often or most often applied to people with healthy lymphatic systems. So if you have a healthy lymphatic system, anytime you create any inflammation, and if you think about a cupping treatment that you've either gotten, seen, or have done recently, if you've ever left the cup on in one spot for a while, you'll notice that when you take the cup off, you will get an indentation where the rim of the cup is, but where the inside of the cup, the hole of the cup where the suction happens, the tissue tends to become a little bit inflamed. And that is probably a product of osmosis, the way fluid moves throughout the interstitial spaces more than anything. It may not be an inflammation from an injury, though it might be, depending on how long the cup was left on and how much suction is there. But because this patient tends to be healthy in their lymphatic system, they're going to recover from that very quickly. Now, when we do cupping for lymphatics, one of the things that we're assuming is that for some reason, this client's lymphatic system is not working as well as it should be, or it's impeded in some way. And that might be local, it might be systemic. But this person is going to have edema or swelling that is sitting around not being taken up. And that could be acute from a brand new injury that is overwhelmed the lymphatic system, or it could be chronic. They've had it for a while because their lymphatic system just isn't capable of pulling enough fluid out. So in cases where the client has edema, cupping is generally contraindicated, and that's because of the effects on the lymphatic system being negative. Because if you leave a cup in one place, that rim of the cup pushing into the skin, which is the equal and opposite force to the suction, that's why the cup stays on, right? So that rim of the cup is actually stopping lymphatic flow because it can't flow. Lymphatic system is a low pressure system, and it can't let fluid go through there. So leaving a cup on for long durations or with high suction or both is probably going to work against you. So not all cupping treatments are lymphatic drainage. In fact, they might be worse off. And the idea of taking a cup and doing a long type of, someone said it earlier, a flushing stroke. And I'm going to say that that is a long excursion-like stroke. That's probably also the wrong way to do it, because we know that the strokes that we use to increase the contractility or contractile forces, or the number of contractions per minute of the lymphatic system, are usually very short and quite abrupt, in that they are a stretch or a shear force on the tissue and then a release of that pressure. So any long, we're not really, like, the body isn't hollow, right? You want the lymph collected, and it's collected and then sent into the tissue. It's not just moved along the surface. So our idea is that if we're increasing the pumping, it's going down into the collector and lymph vessels rather than being pushed along the surface of the skin. So we want to do strokes that are fairly short in distance. And so I don't think a long cupping stroke, a long dynamic cupping or massage cupping stroke, is actually helpful in terms of lymphatic drainage. So in fact, if you look at the way lymphatic drainage is done, if you've taken a manual lymph drainage course, there isn't a whole lot of long effleurage-like strokes. There might be one at the beginning, at the end, and I tend to think of those are more for the person's nervous system than moving any fluid. So while cupping is usually advertised as helpful for lymph drainage, I would dare to say that most times when cupping is done on a generally healthy individual, it's actually not that helpful for lymphatic drainage. It might actually be getting in the way. So I think that's quite interesting. Now, find where my cursor went. What I'd like to leave you with is that cupping lymph for lymphatics doesn't have to be used solely by itself, in the same way that manual lymph drainage doesn't have to be used solely by itself. They can be used in combination. And in fact, most of the time, if I'm going to use it, I'm going to use it in some combination, because joint pumping is joint pumping. It can be done. You don't need cups for that. Sometimes the person is really hairy, so cupping over the hair doesn't create a really good seal, so the manual therapy will work better. Sometimes, as part of my regular treatment on a fairly healthy individual who has had maybe an injury, I might do cupping regularly on other parts of their body, but do manual lymph drainage proximal to the areas where they have some localized inflammation. So you don't have to use one versus the other. It's not always one versus the other. It's how do you take all of these treatments that you know and that you can use and apply them to a patient in a logical manner in order to meet their treatment goals. So I think that's an important thought, I guess, in manual therapy in general, but in cupping for sure. I think if taking courses in cupping and taking courses in lymphatic drainage techniques will improve your knowledge and your comfort level. I think the more courses you take in really all levels of manual therapy, the better rounded you are as a therapist. Because really, we aren't just tissue therapists. We aren't just central nervous system therapists. We aren't just lymphatic drainage therapists. We're dealing with a whole complex person that is our patient. So the more courses you take, the more knowledge you gain, which makes you more comfortable treating more complex patients. So the more you learn, the more complex your patient can be and that you are comfortable dealing with. And I think that's an important point.
Well, Paul, this is probably a good time for me to segue into a question that just came in from Mary, who's asking if you offer classes online.
Yes, we do. The next one coming up, let me look because I keep forgetting, is in February 25th and 26th. It's our first online cupping for lymphatics course, but we also do evidence-informed clinical cupping, which is the prerequisite, which would be on the 28th and 29th. Now, I say prerequisite. If you have taken anybody's cupping course before, you have the prerequisite. I just want you to be comfortable using cups before you take a cupping for lymphatics, because cupping for lymphatics is so specialized, can't also teach you how to use cups at the same time. Does that make sense?
And can you share your URL since we're talking about this right now?
Sure. If you go to cuppingcanada.com or cuppingusa.com. If you're in Canada, use the Canadian store. If you're in the US, use the US store. And that will, in there will be a list of our courses. And the one is called Evidence-Informed Clinical Cupping. That's our weekend basic intro. And then we have the Cupping for Lymphatics, which is February 25th and 26th.
Thank you.
Yeah, no problem. one of the things I like about cupping is that I can apply it if I've injured myself. It's not as hard on my body. So using cupping techniques where I do other manual therapy, whether that's manual lymph drainage or regular massage or regular cupping versus cupping for lymphatics, there are ways to adapt your treatment so you could treat while injured, which I think is a plus for any type of work. As we have long careers, I'm 27 years into my career. I've been injured a few times throughout my career. Sometimes I knew enough that I could do other treatments. Other times earlier in my career, I had to just cancel, and I canceled weeks of treatments in a row. So being able to apply something with your offhand or things like that may help your income. So I think that's interesting. And then lastly, lymphatic drainage techniques and cupping for lymphatics may end for the client with the end of your treatment, but there are other things that you can send them home with. So learn things like exercises for lymph drainage or taping techniques for lymph drainage to teach them or apply them to your clients. Get them to learn some self-care lymph drainage techniques, because you can do a lot of this on clients and they can do it on themselves. So if you can pass along that information, they get better faster, because ultimately that's what they're looking for. None of these in-home things are going to replace you, but it will help maintain their treatments, which will possibly allow you to extend the time in between, making it easier on people's schedules and possibly their wallet. And these techniques have been shown to give better results overall. And that if you get better results overall, it makes you more valuable in the marketplace, which of course is just good business. And with that, I am done. And I just want to say thank you, all of you guys over at Massage Magazine, for having me here today. Thank you to all of you who've come to attend the talk and ask questions. I hope I've piqued your interest. Here's where you can find us. Again, our URLs. And Karen, are there any other questions?
Well, one question came in that I think is important to ask. Rebecca asks you, if a client has lymphedema resulting from cancer treatment, can she use cups? Mentioned that the client is cancer-free and is also receiving compression therapy.
Yes, and it's possible. Again, without the client in front of me, I can't say yes or no, because I don't know anything about what kind of cancer, what treatments were given, what part of the body has edema. So the answer to the question really is it's possible. My suggestion would be, most of the time, start with manual lymph drainage and do it manually until you are comfortable at treating complex patients like that. And at that point, you can start applying cupping with cupping for lymphatics. I don't think cupping for lymphatics necessarily should be your stepping in point to lymphatic drainage. In terms of an escalation of treatment, I think it's a bit more aggressive than manual lymph drainage. So it's not suitable for some clients, and this might be one of those. But without assessing this person personally and looking at their skin and all of that, I can't give you a definitive yes or no. But it is possible. I have used it on breast cancer survivors post-treatment, post-cancer, where they've have been diagnosed as cancer-free. So.
All right. Well, thank you. Do you have anything else that you'd like to add, Paul?
No, I think I'm good.
Okay. Well, I want to thank you so much for this informative webinar. I'll just remind our audience that you're at cuppingcanada.com and cuppingusa.com. I want to thank everyone for attending this webinar from Paul Kohlmeyer and Massage Magazine, and to let you know that you will receive a link to a replay of this webinar within a few days. So thank you again, and everyone have a great day.
Cheers, everyone. Thanks for coming.
Bye-bye.